As we've heard many times, the most important period in a child's physical, emotional, and intellectual development takes place from the prenatal stage to the age of 8. However, a recent report shows the well-being of children in Detroit is at risk because of poverty and limited access to early childhood education and other services. The report by the Wayne County Great Start Collaborative says 1 in 2 children live in poverty in Detroit. That's the highest rate in the country among large cities. In 2010, the number of Detroit children living in poverty jumped from 34.6% to 53.6%. And each year, more than 200 babies born in Wayne County don't live to see their first birthday. The Detroit affiliate of the National Black Child Development Institute is working to improve the quality of life for children and for their families. The group is holding a public policy forum on August 1st to talk about the challenges and the solutions. My guest today is the Vice President of the Detroit affiliate, Allyson Jones. Thanks for being here on American Black Journal.
Hi, Stephen. It's great to be here.
Boy, you read those numbers and you think, are these numbers from 1855 or 1955? They certainly shouldn't be true in 2015.
These are very recent numbers and they're staggering. And so because of the numbers, not only locally but nationally, over 40 years, National Black Child Development Institute has been gathering policymakers. They've been talking to leaders and engaging everyone, parents, educators, in making sure that we talk about and we advocate for issues that affect young Black children and their families.
Yeah.
So this public policy forum that the Detroit affiliate has coming up is really important in that we are engaging organizations and families as well and getting together and talking about the issues and also coming up with strategies to advocate for
It's not just about recognizing the numbers or what they mean. It's about trying to figure out, okay, so what things can we do that really reverse the trends?
Absolutely, and specifically for Black families. So the infant mortality rates for Black babies are actually almost 3 times than that for whites.
For whites,
so it is really, it's really a trying time right now, and it's also a time for us to act.
Is that getting worse, or is that trending better?
The trend actually seems to be pretty stagnant right now.
Yeah.
And we really need to, again, engage families, not only in making sure that they have access to health care, but also making sure that they are, you know, once they have access to health care, using that health care and having a medical home and having prenatal care, and all of that affects not only infant mortality rates, but it actually also affects the mother as mothers continue on and caring for their children.
Right.
So the Detroit affiliate of NBCDI is really, really concerned about the issues, and we also want to make sure that we're engaging everyone in the conversation, including those that are affected the most, the families, the parents,
the families themselves.
Yes.
Of course, these problems are all linked to poverty.
Yes.
But they seem more linked to poverty in the Black community than they are in the white community. In other words, there are a lot of poor white communities and families who don't seem to have the same kinds of effects that Black families have when they live in poverty. What explains that? I mean, there's a racial element to this that I think you have to confront head on.
Absolutely, and so that's some of the conversation that we will be having on August the 1st. If you come to the Northwest campus of Wayne County Community College, you'll be able to hear some of those conversations. Anything from issues around SNAP benefits to other systemic issues and all the way to auto insurance costs. I mean, all of these factors affect young children. You think about a mom who has a young child, if she's worried about getting a job or access to benefits, she's not concerned about educating her child because she's concerned about just the basic stability of her family. And so we talk about all of those issues, and we're not only engaging the educators and the parents and the families, but also policymakers and legislation will be present and will be, you know, sending representatives to hear our voices. And so that's why it's so important for us to, you know, talk about these issues and engage everyone in the conversation so that, you know, Lansing and even nationally, they know that we are concerned about these issues and our voices are heard.
When you think about the city of Detroit, I mean, we are sort of, a lot of people are talking about a tale of two cities, that the progress that we're seeing in some parts of Detroit, downtown and midtown, and some neighborhoods where things are looking up is a real contrast to the rest of the city, where more people live, and where more people live in a much more desperate way. I would imagine that this is sort of a manifestation of that narrative.
Absolutely. And one of the things that is so vital is that we hold one another accountable. We hold the city accountable. We hold the county and the state accountable. And so those are some of the conversations that we're having. We're having those as members of Black Child Development Institute, and you can find information about becoming a member on nbcdi.org and then join the Detroit affiliate, because we do actually have, smaller efforts that as members we participate in. But then, the efforts like this public policy forum are opportunities to talk about some of those gaps. How do we fill those gaps, and how do we as a collective group come forward and say, hey, enough is enough.
Yeah.
We have to make progress, and hey, this is what it could possibly be.
It's not okay that these numbers persist in the way that they do. That one stat that I referenced in the open, the 200 babies each year in Wayne County who don't reach their first birthday. That's an incredible figure. What's the reason for that?
Well, there's quite a few. There's the lack of prenatal care. There is, just smoking. I mean, tons of health issues and health risks. And then some just social determinants of health that come along with poverty are why those numbers exist. They're actually even more staggering for Black babies. So, 14 out of every 1,000 Black babies will not reach their first birthday.
Their first birthday,
and that's amazing.
Right.
Those numbers, they break my heart. I have a 1-year-old daughter, and so as a parent, those numbers break my heart, and so that's why
it's hard to imagine not having that child with you past that first birthday.
Yes.
Yeah.
So,
one of the things I've been talking about a lot in Detroit lately is the sense of isolation that I think those who live in poverty are starting to feel, because the city has emptied out so much, because they live in neighborhoods with probably, in some cases, more abandoned houses than occupied houses, because we don't have a great public transit system for them to get to things, that they live more like the rural poor than urban poor in some other cities. These numbers sort of suggest that isolation is an aggravator here.
Absolutely.
Right?
And one of the things that the Detroit affiliate of NBCDI is trying to do is, when we have events, or if we have, even a membership meeting, we are trying to make sure that we get the information about resources and networks out to
people,
families.
right?
Because there's a lot that exists.
It's really hard in Detroit.
There's actually a lot that exists. There's a lot of programs and initiatives that exist, but people don't know how to access them, or they can't access them.
Right.
And so we are trying to work to not only improve that access, but just get the word out about what's going on, what some of the great initiatives are that can help you get out of that isolation and get into a network.
Right.
Because research shows that a network of supporters will help you not only as a parent, but as a family in general.
Right. What effect do you feel like the constant sort of budget tension in Lansing around support for social services, around support for anti-poverty programs has on this? I mean, I can think of a couple programs off the top of my head that we're not doing real well with in terms of funding, but I can also think of the increased funding for early education in the state, where we're sort of leading the nation in terms of pivoting more toward that. Those two things sort of played both roles, I guess.
Absolutely. And you've brought up two topics where, hey, we've made some improvements in the area of early education. We can't deny that, and that's great. But there is so much work to be done, especially in areas that affect families in general. So maybe not specific to early education, but other budget issues that affect the entire family, which in turn will affect those young children and their education and ability to be educated.
Well, and the earned income tax credit is the other thing that I can think of off the top of my head, where that's a real vital economic lifeline for so many families. And we've cut back on it, and now they're talking about getting rid of it altogether.
And so many families count on that and actually plan and budget in that way. And so these are some of the conversations that not only need to happen immediately, but we will be acting on and calling and sending letters to legislation about, hey, this is what we would like to see, and this is how it affects our babies.
This is how it affects us.
Our most precious citizens are affected by these issues.
Yeah. Yeah. So the August 1st forum,
Yes.
open to the public?
Open to the public. And again, it's going to be held at the Northwest campus of Wayne County Community College, 9:30 to noon. We're inviting, if you have a young child in your life that you care about, you can come.
Bring them out.
Yeah, definitely. Come out and join us. This is important for us to discuss these issues, and it's important for us to come together as a group to talk about it.
All right. Well, let's hope this leads to some solution making.
It will.
Yeah. Thank you for being here.
Thank you so much.
Yeah.